If the battle of today is not fought and not won, there will be no battle to fight tomorrow. Let me turn to Sweden. I quote from a report by Dr. Gunnar Bjork. In Minnesota, I should be able to pronounce a Swedish name, but it takes more than physical connection. He's a professor of medicine at the Karolinska Institute. He's a head of the Department of Medicine at a major hospital in Stockholm. He formerly was, and maybe still is, a physician to the King of Sweden. He gave a paper in 1976 at the University of Chicago on, quote, how to be a clinician in a socialist country. And I quote from his paper. It is obvious that the existence of a competing free market constitutes a continuous threat to the operation of a socialist public service, however heavily subsidized by taxpayers' money. The element of quality that derives from patients' personal preference for and confidence in certain doctors cannot easily be done away with so long as people are willing to pay for a free choice of physicians. To do away with such opportunities, therefore, has become a new goal of Swedish healthcare politicians. The introduction of these various regulatory processes has resulted in a cancerous growth in the numbers of medical administrators at all levels of incompetence. The Board of Welfare, I go on quoting, has recently issued a 60-page book trying to describe how to calculate the number of physicians needed to cover the necessary staff of any one clinical department. The book is a fascinating monument over the total absurdity into which legislators, administrators, and trade union representatives have finally brought a previously simple and efficient machinery. The setting in which medicine has been practiced during thousands of years has been one in which the patient has been the client and employer of the physician. Today, the state, in one manifestation or the other, claims to be the employer, and thus the one to prescribe the conditions under which the physician has to carry out his work. These conditions may not, and will eventually not, be restricted to working hours, salaries, and certified drugs. They may invade the whole territory of the patient-physician relationship. If the battle of today is not fought and not won, there will be no battle to fight tomorrow.